Hi, my name is Dr. Caxno Perry, the world's leading expert on the medical complications of divorce. What I want to do today is to share with you the significance of addressing divorce as a risk factor for strokes and heart attacks. Today, we're going to make a comparison between a person who has specific risk factors for a stroke and a heart attack and compare that per individual with someone who has none of those risk factors but is divorced. As I said in How Divorce Kills, divorce is a significant risk factor for a stroke. In fact, it doubles in most instances the risk of having a stroke. So the real question is, if having a divorce doubles your risk for a stroke, what happens to the other risk factors for a stroke? For example, high cholesterol, hypertension, old age, congestive heart failure, diabetes, a previous stroke or a mini stroke, what's referred to as a CHADS-2. CHADS-2, I'm going to go over it with you, is a way of evaluating the risk of developing a stroke in patients who have what's called atrial fibrillation. I'm going to explain that. Atrial fibrillation is an abnormal and irregular beating heart. Anyone who has an abnormal, irregular beating heart may have a clot form inside the chambers of the heart due to the irregular beating of the heart. When that happens, a clot that forms can go into the brain. If it goes into the brain, it blocks off blood supply and you have what's called an ischemic stroke. Now, to prevent that stroke, you put patients on either aspirin or Coumadin or the newer drugs that are called blood thinners, anticoagulants. What happens is that as the blood is thinned out, it reduces the likelihood of a clot forming. Now, I can see that with this whole picture of me saying blood clots, you can actually see the danger that having atrial fibrillation as a diagnosis poses. So a person who has atrial fibrillation is at risk of having a stroke. A stroke, as you may or may not know, is one of the 4 leading causes of death in the United States alone. There is a stroke once every 4 minutes. And about 130,000 people die every year of a stroke. So it's a significant thing. Now what I want to do is to share with you, I'm going to write some things down on the board so you can see. First is congestive heart failure. If a person has atrial fibrillation, that is an irregularly beating heart, and they don't take any medicines at all, if they have any one of these alphabetical things I'm going to list, their risk of a stroke increases gradually to the point where almost a 20% chance of having a stroke occurs in that person's risk evaluation process. So the first thing that we're going to look at in a patient who has atrial fibrillation is congestive heart failure. If a person has congestive heart failure, you give them 1 point. If they are hypertension, you also score them a point. Age more than 75 or equal to 75. Diabetes. A prior stroke, a mini stroke. So that's CHADS S2. There's some other ones, newer ones, but I'm just going to use this simple CHADS-2 to explain to you what happens when you have a patient who has atrial fibrillation and is at risk of developing a stroke. So when you add all this up and you begin to look at the score. If a person has one of these risk factors, in addition to the atrial fibrillation, remember I said anyone with atrial fibrillation should get anticoagulated, blood cleaned out, so the clot doesn't form in the chambers of the heart. Now, if a person does not get the blood thinner, aspirin or Coumadin or the likes, and has one risk factor out of these CHADs, hypertension, age more than or equal to 75, diabetes, a prior stroke, a prior mini stroke, okay? If they have one risk factor, if they have 0 risk factors, one risk factor puts them at risk of about 1.8%. 2 risk factors, 2.8%. 3 risk factors, about 4%. 4 risk factors, about 5.8%. 5 risk factors, about 8%. 6 risk factors, about 10. And when you add all of these factors up, the maximum that a person has of developing a stroke in any 1 year, the maximum risk is 18.2%. That is, if a person has congestive heart failure, hypertension, is more than 75 years old, has diabetes, has had a stroke, or has had a mini stroke, all of those, the risk of that person with AFib, remember, with AFib, developing a stroke in any given year is 18.2%. Wow. Hypertension, congestive heart failure, again, age, diabetes, stroke, gives you a risk annually of 18%. When a person is divorced, the risk of developing a stroke doubles, which means 100%. Now, I want you to see this carefully. 5 to 6 disease entities combined increase your risk of developing a stroke 18.2%. Wow. Yet, having a divorce doubles your risk. That means 100% more likely that a person will develop a stroke. This is scary. And the truth of it is, divorce is not even recognized as a risk factor for strokes or heart attacks. So, not just strokes, but also heart attacks. And the illustration, there's something called the NIH score. On the website for the NIH, there is a calculator that you can use to see if a person has high cholesterol, hypertension, they're certain age, over 65, they have diabetes, they smoke. These things, when you plug them in, a person who smokes automatically will have about maybe 13% a risk of having a heart attack. A person with high cholesterol, hypertension, smokes, is more than 45 years old, and has diabetes and all this other stuff, has a risk that goes up to about 30% maximum. That's for a heart attack. But the risk of having a heart attack when a person is divorced, again, is what? Double. 100%. So you can see very clearly that all the traditional risk factors for a stroke combined are not as great, when all of them are combined, are not as great as having a divorce when it comes to the risk of having a stroke. As a matter of fact, if you do the numbers, 100 over 18 means 5.56 times more likely that a person who is 45 years old with no prior illness after going through a traumatic marriage that ends in divorce is maybe 5 times more likely to have a stroke compared to a 75-year-old man who has atrial fibrillation, hypertension, diabetes, and has had a stroke before. That's interesting. Secondly, the same manner, you look at someone who's 37, has no medical illness, but is divorced. That person, when you look at the numbers, when you say 30% with all the risk factors versus 100% in a person who is divorced. So the person who is divorced is 3 times. These are simple numbers. And if you go to my website, www.drcaxton.com, you'll find some more information that will help you understand how divorce poses a great risk and is an epidemiologic marker of disease, disability, and death. It has been ignored by most physicians, and that should not be the case. Have a wonderful day. Dr. Caxton Operi. Thank you.